A very good evening to all of you. I'm Dr. Hardik Thakker. I'm an MD cardiologist practicing in Mumbai. Today I take this opportunity to talk to you about coronary artery disease. As we know, it is a very common non-communicable disease that is found in Indian population. So a blood supply, what happens is the blood vessels which supply blood to the heart muscle, they are called as coronary arteries. All through the years of life, we eat foods which are rich in oil, cholesterol and ghee. This leads to deposition of cholesterol plaques in these blood vessels which give oxygen and blood to the heart muscle. So when you are exerting or when you are having an exercise, the blood is supposed to increase, the flow of blood increases and the oxygen supply should increase. However, in coronary artery disease, this does not happen because of the cholesterol plaques which cause blockages. As a result, there is ischemia and the muscle of the heart does not get enough oxygen. That leads to death of the muscle, and that's called as myocardial infarction. So typically because of this, the patient complains of chest pain. Initially the chest pain will be only on exertion, when he's exercising, when he's walking or when he's swimming, and later this will happen even at rest. That is, even when in his sleep he may be woken up with this chest pain. So what are the other comorbidities? So why does this happen? So one of the comorbid conditions is diabetes. Patients with diabetes are very high risk, at a very high risk for coronary artery disease. Secondly, genetics, smoking, alcohol consumption and age. These are the other risk factors for coronary artery disease. People sometimes have rare disorders of cholesterol metabolism like beta lipoproteinemia, familial hypertriglyceridemia. They are also rarely the causes of coronary artery disease. So whatever may be the comorbid condition, the person has to report to the doctor immediately, and there is something called as primary PCI. So what we try to do is, that is the gold standard of treatment for patients with coronary artery disease. We take the person for an emergent angiography, and following which we do either the stenting or we advise the bypass. And if the patient has a low BP, there is an ICU stay involved. It can go up to 2 to 3 days with an IABP placement even could be required for that. For more details about coronary artery disease and its treatment and management, you can refer to me on my website, which is www.lybrate.com/Dr. Hardik Thakker.